Pharmacy is truly one of a kind profession. Being a pharmacist is like the coolest thing. Like you're able to understand and explain super cool concepts on such a high level. Why can't you eat epinephrine, insulin, or nicotine? Like why is it injected, intranasal, inhaled, buccal, transdermal? Why can you cut some medication patches and others not? What would happen if you inject a medication that's meant for oral use? Why can you breastfeed on some medications and others not? Why do some drugs interact? For example, grapefruit juice, it doesn't interact with everything. What drugs will cross-react or flag positive on a urine drug screen? Why? What drugs worsen disease states like Alzheimer's and Parkinson's? How can some medications be administered together in an IV line and others it would be dangerous? How can you split some extended release tablets but others you can't? What happens if you double dose on a certain medication or take the whole bottle? How do reversal agents work in overdose situations? For example, how can we use alcohol or vodka in an ethylene glycol or antifreeze overdose? Why are vitamins and electrolytes important? What do they do in the molecular level? Why do some creams and gels stay local, like lidocaine, and some get systemic, like testosterone? Why do you need to load some medications, or why do they require an initial higher starting dose? Why do you need to titrate and taper certain medications, and how? When and why do medications expire? Is it dangerous to take expired meds? How can you use Symbicort as a rescue inhaler but Advair you can't? Is a newly approved drug an advantage to what's already on the market? Why are drugs so expensive? Does dialysis remove this drug? Why or why not? Does it make sense to use this drug off-label for this indication? How can we use IV metronidazole to treat C. diff but IV vancomycin we can't? Why don't we use Z-Paks for UTIs? Why is thiopurine methyltransferase polymorphism important with mercaptopurine and azathioprine? Why are some drugs so bitter? If you want to learn any of this and be able to use those skills in the clinical setting, I would think about pharmacy school. I'm really glad I chose this profession.